How did people manage ascites fluid before modern medicine? Imagine a time when doctors had no fancy machines or powerful drugs to treat fluid buildup in the belly. Before modern medicine, managing ascites was mostly about simple, practical methods based on observation and tradition. People believed that controlling how much fluid entered and left the body could help reduce swelling. They often advised patients to drink less water and avoid salty foods, even if the understanding of sodium's role in fluid retention was not yet clear. To encourage fluid loss, they used methods like exposing the body to heat, placing patients in heated rooms, covering them with heated sand, or using dry ovens to induce sweating. The idea was that sweating could help rid the body of excess fluid naturally. Herbal remedies also played a part. Some practitioners prescribed pills made from herbs like wormwood and myrrh, taken on an empty stomach. These remedies aimed to stimulate the body to eliminate excess fluid, but they lacked scientific proof of effectiveness. Careful monitoring was another key aspect. Patients or caregivers would measure abdominal size daily and keep track of how much fluid they drank and expelled. This simple tracking helped guide decisions about diet and activity, although it was not as precise as modern medical tests. The first major breakthrough in managing ascites came in the early 20th century with the development of paracentesis. This procedure involves draining fluid directly from the abdomen with a needle, providing quick relief from discomfort. Before that, most treatments focused on symptom relief rather than targeting the underlying cause. Dietary management was not well understood until the 1930s and 1940s, when research showed that salt played a big role in fluid retention. Before this, people might have just avoided salty foods based on traditional advice, but specific sodium restrictions were not yet standard. Rest and avoiding strenuous activity were also recommended to prevent worsening the condition. In essence, managing ascites before modern medicine relied on a combination of reducing fluid intake, promoting sweating through heat, herbal remedies, careful observation, and rest. These approaches were largely based on trial and error rather than scientific evidence. Today, we understand that controlling salt intake, using diuretics, and performing procedures like paracentesis are more effective and safer. Still, these old methods reflected the ingenuity and resourcefulness of past caregivers trying to ease suffering with what they knew at the time. Always remember, if you or someone you know is dealing with ascites, it's important to consult healthcare professionals for proper diagnosis and treatment.